Palliative care is the cutting edge of where we need to go with medical care.
Palliative care is offering comfort to alleviate symptoms, emotional, spiritual, and physiologic symptoms. So often, other individuals in the hospital are doing a task. They're hanging an IV, taking vital signs. We know what's happening medically. We can read the chart and read the lab work, but we want to know on a deeper level and find out what's really the essential components.
We start with a story because everybody has a story.
So our team approaches that family, that patient, that setting, looking through a different lens.
What are the patient's wishes? What do they want, and what does the family, how can they be best supported?
When we enter into a room in a consult, it's with our whole team. So in the room, usually there's 2, if not 3, sometimes 4 people on our team with that patient and family.
We talk to them about who they are outside of the hospital bed.
All they've been doing is hearing about what's wrong with them and what's the matter and how are we going to fix it. And we instead try to go in and say, yes, we know that you have an illness. We know that there is something the matter with you. But within the context of that comes the really most important piece, which is what really matters to you at this time of life.
And this is something that we often feed back to primary care doctors to give them a more robust, round view of this patient, so that then in the future they know the patient on a more intimate level.
From my point of view, you can't really take care of a patient without being a palliative physician, because you need to hear their story and you need to know how they're viewing things and what their understanding is of things before you can even start to talk to patients about a treatment plan and what their goals are.
We have a saying at Providence, know me, care for me, and ease my way. Unless I know you, I really can't care for you. I can't ease your way if I don't know what I'm easing your way through.
What we provide is a chance for someone to be witnessed. We crave that, and sometimes that is the symptom management that's needed.
You have this group of people who are there to really pay attention to what's important to you. To families, it's the support that a lot of families just need when someone's hospitalized. It's a really tough time.
This is an invaluable opportunity for donors, for our community to be involved, because every one of us will need it, will utilize it at some point in our lives.
Palliative care is a free service offered because Providence values what matters most.
Palliative care is about taking care of our community. It's something that can touch everyone's lives.
And in order to expand this service in the Rogue Valley to not just patients in the hospital, but patients in the home setting, we need help.
We need the help. It's needed. It's being asked for. We're wanting to give it.
We need that team to be present and to never go away. It's the caring difference you can really feel at Providence because of palliative care.